Today, we are going to be talking about dark circles under the eyes because this is a problem that bothers anybody that has it, and it's one of the first things that happen as we start to age that can kind of give away the age and the sun damage or other problems that we've accumulated. And we talked on a previous episode about the skin on the back of our hands, crepey skin on the body, and how to reverse that. So today, we're going to focus on that under eye area and dark circles under the eyes. We'll touch a little bit on eye bags, and I'm going to talk about the main causes, and I'm going to go over both the over-the-counter treatments, natural treatments, and sometimes prescription treatments or procedures that you can do to help correct this if you suffer from dark circles under the eyes. I had a patient in not too long ago, and they were talking about their eye bags, and they said, I don't have eye bags, I have eye luggage, because they were so distressed about the skin under their eyes. And so we're going to be talking about everything that I recommended for them, everything that you can do, and there's three main types of dark circles under the eyes, and they're not all created equally, therefore they can't all be treated equally. There is no one-size-fits-all solution for this. Let's talk about the three main types of dark circles under the eyes. The first type is anatomic shadowing. We're going to get more into detail on each of these as we go. The second type is just thin eyelid skin. You have thinner skin on the eyelid naturally, whoever you are, but some people have more thin skin, which allows the underlying structures to shine through. And the third is going to be true hyperpigmentation. This is where there is actual pigment deposition underneath the skin, and we'll discuss the specific treatments for that. But let's start with anatomic shadowing, when you just have that anatomic structure that gives you the dark appearance under the eyes. This is something that's going to run in families, and it's just the way that your bony structure, your muscles, and your fat pads sit on your face, and this can give a more depressed appearance under the eyes. If you are underslept or you've been drinking alcohol more, this can be exacerbated, but the reality is there's not really much you can do to change the genetics that you have. This can be a difficult thing to treat, and the anatomic differences that you have on the face cannot be corrected simply by putting eye cream on there. When we have dark circles due to anatomic shadowing, it can get worse under certain lighting conditions, and as I mentioned, it can get worse if you haven't been sleeping enough or if you've been drinking alcohol more. There's so many different causes. Now, if this is something you suffer from, let's talk about the natural treatments that you could pursue. First off, we can try gua sha. This is a facial massage technique to help remove lymphatic drainage out of the face, just so that you don't have extra puffiness in any area. You get a more smooth contour from the eyelid skin onto the cheek. It's important to note this is just a temporary solution. Gua sha does not induce any permanent changes to your facial structure, despite what any influencers online might say. Also, this is an area where sleep is important, because sleep, or the lack thereof, are going to make these anatomic depressions look worse. Because I don't care who you are, you could be the most beautiful person on the planet. If you haven't gotten enough sleep, it does start to show underneath your eyes, and that can be a telltale sign. So I do recommend prioritizing sleep. As an adult, you need 7 to 9 hours a night in an ideal situation. And if you're struggling to get the right kind of sleep, I've talked on other episodes about sleep hygiene, how to improve your sleep. You want to go to bed at the same time, wake up at the same time, sleep in a cool room. I use the 8 Sleep pod cover to regulate the temperature of my mattress. I track my sleep on the Oura Ring. There's lots of things you can do to try to improve your sleep, and that's a topic for a whole nother episode. We're not going to do a deep dive into that today, but sleep is critically important for the appearance of dark circles under the eyes. I've touched on it a little bit already, but if you drink a lot of alcohol, that's also going to make these dark circles look worse. So moderating your alcohol intake, ideally you should eliminate it altogether, because in reality, for your health, there are no redeeming qualities to alcohol. Yes, it might help you have more fun in a social situation, but even that can disturb your sleep. It raises your stress hormone levels, and when you're not sleeping as well, you've got more cortisol running through your body. It is going to increase the prominence of your under eye circles. If you start to get bags where it gets puffy under that area, this can be anatomic as well. And from a natural and holistic perspective, sometimes I will recommend that patients take tea bags and you steep them in hot water, But then once they are fully steeped, you take them out, you can just put them in a Ziploc bag and put them in your refrigerator. You want to cool them down, but they'll still remain damp. You don't want to lose all the water. And then in the morning time, you can take those tea bags and you can place them under your eyes. And that has antioxidant effects, and it can help with the cooling to help improve the appearance of dark circles. You do want to make sure it's not causing irritation. This is just a more natural solution. It's not something that I recommend all of the time to my patients, but it is something that can be done. And lastly, from a holistic perspective, trying to have a more anti-inflammatory diet. That means less processed foods, less foods with added sugars. Avoid sugary soda drinks and other sugary drinks. Those types of things do lead to more inflammation in the body and can exacerbate the appearance of under eye dark circles. Let's now touch on what you can do from a treatment perspective if you are seeing a board-certified dermatologist or maybe a plastic surgeon. When you have anatomic differences in the skin or in the underlying bony structures, one of the more reliable ways to correct that is going to be through the use of fillers. Fillers like hyaluronic acid-based fillers, or more in-depth procedures like fat transfer, where they'll take fat from one area of your body and inject it under the skin there to actually recreate some volume so you kind of compensate for that anatomic differences in the bony structure. Can be a fantastic way. But anytime you're doing this, I highly recommend that you do it with a board-certified dermatologist, because these procedures do carry risk of bruising, of vascular occlusion. They can lead to serious complications if they're not done by professionals. Moving on to the second reason for dark under eye circles, and this would be very thin eyelid skin. Now, in general, your eyelid skin is the thinnest skin on the body. However, some people have even thinner skin, or they may have more prominent vessels underneath that skin, or they may have a more prominent orbicularis oculi muscle. That's the muscle that closes our eyes tightly. When your skin is very thin there, it can make those underlying structures more visible. If you've ever looked at a newborn baby, their skin is thinner and you can see the blue veins on their forehead, especially if they don't have any hair yet. And this is essentially what can happen underneath the eyes. And if you have prominent veins that are contributing to a dark appearance, or a prominent orbicularis oculi muscle, this is something, again, that is difficult to change just with creams, but there are some things that can be done. From a natural and holistic perspective, again, I will touch on sleep, alcohol consumption, and a healthy diet, because if you're not following those types of recommendations, these can also appear worse. Now, if you're trying to improve the thickness of the skin under the eyes, this is where we get into eye cream recommendations, and you're going to see some benefit from using a retinol-based eye cream. One of the ones that I often recommend to my own patients is the ROC Retinol Correction Eye Cream. This one is not terribly expensive, and it is an OG eye cream. It's been around a long time, and it's got a retinol that is specifically formulated for that sensitive under eye skin. You don't want to take the same retinol that you use on your face and start smearing that under the eyelid skin, because you will experience irritation. And if you start getting eczema under the eyes because you're using a strong retinol, at that point you're going to make new problems, or you're going to make your existing problem worse with all of that extra inflammation. So it is important to choose a retinol-based eye cream specifically formulated for that thin and sensitive eyelid skin. Retinol is clinically proven to boost collagen levels under the skin. They will increase the thickness of the healthy cell layers, but they do decrease the thickness of the dead skin cell layer. That decrease in dead skin cells is not something that's going to further expose the under eye structures. But when you boost your collagen and your healthy skin cell layers, you should see less of those underlying structures, less of the blood vessels, less of the orbicularis oculi muscle. So that is an approach that I recommend frequently for my patients. In the office, we use the Skin Better Alpha Ret eye cream. It is a retinol eye cream, but over the counter and much less expensive is going to be the ROC Retinol Correction eye cream. Now, if the dark appearance is due to prominent blood vessels, this is where a caffeine-based eye cream may be very helpful for you, and there is a really inexpensive one that's easily available at pretty much any drugstore. This eye cream is from Neutrogena, and it's the Hydro Boost Plus Caffeine Eye Gel Cream. Most of the Neutrogena products are under $15. This one might be a little closer to $20, but I'll have links for all of the product recommendations right down in the video description. You can check them out there. And if I can provide discounts, you can be sure that the links will include those discounts. Caffeine is going to help constrict the blood vessels. And so if you have a blood vessel that's big and dilated and you put caffeine on there, it can help to constrict them, making them less prominent under the skin. So if your dark circles are due to very thin eyelid skin, look at using a retinol-based eye cream or a caffeine-based eye cream, depending on the exact nature of your thin skin. Now this leads us into true hyperpigmentation of the skin. This is true excess pigmentation that causes dark circles to appear. And there's a lot of potential causes of this. We're gonna dive into some of those causes and a multitude of treatments. This will be the more in-depth portion of the video, so thank you for sticking with me. True hyperpigmentation caused by a number of things. One of those is genetics. Some people are just going to have more genetic predisposition to producing pigment under the eyes. There are certain ethnicities that this is going to be a bigger problem for than other ethnicities. Generally, those of South Asian descent can have a bigger problem with this just because of the nature of their genetics. If you have allergies, this is another reason that you might experience dark circles under the eyes with increased pigment deposition. When you have a lot of allergies and your eyes are frequently watering, you're sneezing, you're rubbing your eyes, you're blowing your nose, all of this is going to create congestion and inflammation under the skin that can look like pigmentation. And in fact, there is pigmentation there. There's a specific type of pigmentation you can get called Denny Morgan's lines, where you get thickening of the skin, you get increased pigment deposition, and you get almost an eczema-like appearance. And this is more common in children who are frequently rubbing their eyes when they have atopic dermatitis, allergies, allergic rhinitis, but it will cause dark circles to appear. If you've had any injury under the eyes, you might experience post-inflammatory hyperpigmentation. So if you're rubbing your eyes a lot, that can cause some form of an injury, or if you have any other surgery under there, this will cause pigment deposition due to all the inflammation that is required to heal whatever that injury might have been. We've already touched on eczema a little bit, but that can happen in adults as well. So eczema or atopic dermatitis often goes along with allergic rhinitis. You have seasonal allergies, and that will, over time, increase inflammation under the eyes. So to touch on a few of the kind of more natural treatments, again, I will just touch on sleep, alcohol consumption. It can make it worse. Better diet is going to generally improve things as well. If you suffer from seasonal or environmental allergies, you should look into getting hypoallergenic pillowcases and hypoallergenic sheets. And it might even be a good idea to sleep with an air purifier in your bedroom just to help remove excess allergens from your environment. While we're on the theme of allergies, if you have allergies, it can be a good idea to take a non-sedating antihistamine. What are the non-sedating antihistamines? That's going to be things like Claritin, Allegra, or Zyrtec. These are second-generation antihistamines, and when you block those histamine receptors in the skin, you're not going to get that inflammatory response to the same degree. These are safe to take on a daily basis, as long as you're not taking the ones with decongestant in it. That's pseudoephedrine. You don't want to be taking that every day. It's a stimulant and it'll cause dry eyes, dry mouth. It can end up leading to its own problems. Just the regular ones, the store brands I find are generally just as good as the name brand ones. You can buy a lot more of them for a lot less expensive price. If your eyes are frequently irritated, the Pat-A-Day eye drops are now available over the counter as well. That is an antihistamine eye drop that can help with eye allergies. If you have true hyperpigmentation under the eyes, whether that's due to genetics or a number of other conditions, as far as the eye creams that you can choose, again, retinol is going to be a beneficial ingredient here. In addition to building collagen, retinol can help to turn over the skin cells and lead to a decrease in pigment over time. Bonus points if you find a retinol eye cream that has niacinamide in there. Niacinamide is an effective ingredient to help with pigmentation. It is kind of a jack of all trades, master of none. It helps with acne, it helps with pigmentation, it helps with pore size, it helps with oil production. So it is something that can serve a lot of different purposes in the skin, and it does help with those dark under eye circles. Other ingredients to look for are kojic acid, azelaic acid, licorice root extract, and even hydroquinone. Now, we don't see a lot of eye creams with hydroquinone, and you do have to be careful with it. We'll leave that to another discussion. I'm not strongly recommend hydroquinone in your eye creams, but some of those other ingredients that I mentioned, I will include some product recommendations down in the video description so you can check those out. Another one that I really like is the eye slugging balm from Jour Cosmetics. It has a lot of good ingredients to help with under eye circles, and it's very, very hydrating. Peptide eye creams can also be very helpful in this case. Peptides are going to be generally less irritating than a retinol-based eye cream. Peptides can help to stimulate collagen production, similar to the way that retinol eye creams will, but they, again, just tend to be less irritating. And one of my favorites is the Healthy Renew Eye Gel from Cetaphil. Very inexpensive. For a peptide-based eye cream, you're getting a great price on that. Now, if you've done all of these things and you're still suffering from dark under eye circles, or you're still suffering from severe allergies, you can take anti-inflammatory supplements like turmeric or curcumin. Turmeric or curcumin? Turmeric or curcumin. I can't say that well. You can also do allergy testing and full allergy treatments from a board-certified allergist immunologist. They're going to be very helpful if allergies is the primary cause of your dark under eye circles. And lastly, if all else fails, see a board-certified dermatologist, inquire about laser procedures or an oculoplastic surgeon for other procedures that might be done to help limit the appearance of dark under eye circles. As you can see, there's so many different potential causes of dark under eye circles, but there are good treatment approaches available, both in the natural holistic side as well as the over-the-counter eye cream side, and then there's procedures that you can do with a board-certified dermatologist. Hopefully this is just as helpful as that crepey skin episode that we did, and if you guys have other questions about specific anti-aging concerns that I can address on the channel, I want you to leave them right down in the video comments, and if you haven't seen the crepey skin episode, I'm going to have it right here for you, as well as other suggested videos that I think you're going to enjoy. Thank you for supporting the channel, supporting my mobile clinic endeavors, where I try to provide free skincare to as many people as I can. I'll see you guys on the next video.